And we've got our third speaker for this session. We're incredibly lucky to have Ishani Rao, who's a general practitioner who has devoted much of her life working on sustainable diets and what we can do at home and at work to reduce our impact through what we eat. Thank you, Ishani.
Thanks, guys. Hello, my name's Dr. Rao, Ishani Rao, and I'm an NHS GP, and I'm on the team for the wonderful Ecomedics, and I'll tell you a little bit more about Ecomedics in a minute. I would like to speak to you about a topic that's really, really close to my heart, and that is food. I absolutely love food. Most of the pictures here are photos of my food, so photos that I've taken, and I want to be talking to you about how we can be eating more sustainably and why it's important. So a bit about my background is that I recently qualified as an NHS GP and I absolutely love my job. I actually am an emergency medic at heart, but it was difficult to work with that much waste. And I thought a really good way of moving into preventative medicine where we'd be able to reduce our need for resources, investigations and medications, is to do general practice. So I absolutely love doing lifestyle medicine, preventative medicine and general practice. My background's women's health. I'm taking my master's in global health policy at the moment. And I've recently done talks about food and sustainability for the BBC, for Parliament, and about 20 for NHS sustainability leads as well. I'm a happy conservation scuba diver, and I'm on the teams for plant-based health professionals and Ecomedics. So Ecomedics was founded by my lovely colleague Nathan Hudson Peacock, who works at St Thomas's as an emergency registrar. It was started in 2020 and it focused on reducing single-use materials in hospitals. Initially, it was coffee cups, but we've now transitioned that into a lot of quality improvement projects across various hospitals across the country. So there's a great quality improvement bank online if you want to check that out, if you're interested in getting involved with some of the quality improvement projects. Now we host podcasts, conferences at the Royal Geographic Society, which are absolutely amazing. We're hoping to plan another one for next year. And we also host sharing circles for medics and healthcare professionals concerned about the climate crisis. And they're being received really, really well. And we've got one tomorrow evening if anybody wants to come in East London. So I just want to say thank you so much to the organisers for today, for having me, for having all of us, and to you guys for coming, because I think it can be quite isolating when you feel like you're putting in so much effort into something that other people might not seem to care about. But there's so many of us here, and we all have this shared value of caring about the climate crisis, of caring about our environment, and of trying to manifest that into things that we can do in everyday practice. And I think that's so very important for us to network and come to events like this. So yeah, just let's remember the things that we have in common, because that's so very valuable for trying to transition towards a better future. So why is my passion food? One, because it's yummy, because that was my lunch last week. And two, because about 20% of the UK's carbon emissions come from our food industry. So whether that's from farm to fork, all of the processes in between, that's an enormous amount of greenhouse gases generated from what we eat. I worked on the eating disorders unit at Bethlehem Hospital, which was the highest secure eating disorders unit in the world. And I also did my global health project, for which I won awards in Sri Lanka. And I saw this massive imbalance between people that undereat and don't have enough calories. And then what I see now every day in general practice is people overeating, obesity, diabetes, high blood pressure, all of these preventable conditions. And I thought, why is there this massive mismatch and disparity between people who are malnourished and people who are overeating? And what can we do to prevent that? I then developed an unhealthy, I'd say, relationship with food as a junior doctor, where I was rushing around, I was eating in front of my desk, I wasn't really mindful about what I was eating. And I thought, you know what, actually food is so important. It's such a social thing. We see the tapas culture in Spain, where life expectancy is 5 years greater than the UK. And I thought, okay, well, I need to become more mindful about what I'm eating, become healthier, and to try and help people develop their healthy relationships with food as well. As when I was 3 or 4, I realized that the animal agriculture industry is unsustainable. Went vegetarian when I was 10, and have become a keen vegan advocate for the last 8 or 9 years. So this is about waste. I love a good infograph. I think it's really, really useful, and it says a lot. What it says here, and two key things that I want to point out is that 1/3 of food in the UK is wasted, and half of that is said to be edible. That if we stop wasting food, the carbon dioxide impact would be the equivalent of taking 1 in 4 cars off the road. So food waste is obviously a massive problem. And on an individual scale, there are things that we can do to try and reduce that are really good fun. This is my 5-litre jar of kimchi made from my vegetable scraps. But in terms of what we can do in hospitals, there are loads of things which are being trialled and tested, which is having patients choose in the morning or the evening before so that they can choose what they want to eat, having smaller portions so that patients can order them again if they're hungry, having more patient choice so that patients are happy with what they're eating, but also investing in things like compost schemes as well so that we can improve the quality of the soil with the food waste that we're producing. So I love this, and the British Dietetics Association has a really good infograph about seasonal fruit and vegetables. And if we can start encouraging hospital procurement services to start looking at just ingredients like this and start trying to decide when things are appropriate to buy within the year, then this is an amazing way of reducing the energy that's needed to control for external environments with regards to our food, whether that's humidity, UV light, temperatures. So buying seasonally is really important. So, sorry, I didn't take that photo. I've stolen it off Reddit. And it says pears grown in Argentina and packaged in Thailand. So we've all seen things like this, where we can see how inefficient the food chain is. We know that a can of pears like this, a box of pears like this, would be sold for about 50p. So there's so much money being lost and so much energy being lost. And we know 10% of food is lost at each stage of the packaging chain as well. And 50p, that's not really going back to the people that are growing it, packaging it, is it? It's not really fair to see where that financial distribution goes and how cheap the food that we receive actually is. So we've all heard buying seasonally, buying locally, and that's really important. But actually, if we're looking, for example, at transport is red there. That's transport. The green is land use, and the brown is farming. And we know that the UK's farming practices are one of the main contributors to carbon dioxide and greenhouse gas emissions. So actually what's more important is looking at what we're eating. And we can see that up here we've got beef, lamb, cheese, dairy beef, chocolate, coffee, prawns, palm oil, pig, and then down there is lots of fruit and vegetables. So actually looking at what we're eating is much more important than buying seasonally, buying locally, but which is also important. I was interviewed last week, 2 weeks ago, by the Climate News magazine, and they said to me, "Oh, so what do you think about the new data from Oxford University that says that we need to be reducing our reliance on the animal agriculture industry in order to combat climate change?" And I just said, how much more evidence do we need? We've got the UN, we've got the International Panel for Climate Change, we've got Oxford, the Lancet, the World Economic Forum. We've got all of these amazing sources saying that we need to reduce our reliance on animal agriculture and transition towards a whole food plant-based diet. I don't know how much more evidence that we need, but hey, there's some of the amazing resources which are telling us that this is really, really important for combating climate change. So some fun facts. The livestock industry generates more greenhouse gases emissions than the entirety of the transport sector. We know that a commonly quoted statistic is that one beef burger requires 30 bathtubs of water to produce. I think soya gets a really bad rep because the Amazon is being deforested for soya growth, but 80% of that soya is being used to feed to cows, which are then being used to feed to us. So that was one of the things that I thought, this is where the imbalance is. This is why I'm going to Sri Lanka and I'm seeing all of these people who are really malnourished and don't have access to these calories, but the fields are green and there's so many crops being grown, and I couldn't really work out where that imbalance was coming from. But it's actually that one inadequate, inefficient step in the food chain that means that we're feeding the calories towards the livestock rather than feeding it to humans. So yeah, there's some facts there. And then this is another one, is that I just wanted to highlight there's so many good dairy alternatives, so many delicious dairy alternatives. And I think, again, almond milk in the press for some reason gets a really bad reputation. But actually, when we look at it in terms of carbon emissions, land use and water use, it's still much better than the dairy industry. And actually, the dairy industry is the largest supporter of the beef industry. So this is something that's really close to my heart because as a conservation scuba diver, I was the second person in the world to be certified by PADI as a scientific diver. And that's what I want to go into because I think the oceans are so vital for biodiversity and for supporting coastal communities. But we know that the largest cause of plastic pollution is commercial fishing. And you can see that when I'm going and I'm unhooking all of the fishing nets, all of the fishing hooks and things like that. And actually the bottom of the ocean is a massive sink for carbon. So as soon as we start to disrupt that, then all of that carbon is released into the atmosphere. So I love this slide because I think lots of people find this quite shocking, and I find it shocking every time that the WHO is classifying sausages, hot dogs, bacon, salami as class 1 carcinogens, which is on the same scale as tobacco and asbestos, and we're serving them to children and to sick patients in hospitals. So yeah, that's something that always shocks me. And I think that's really important to let people know, let hospital suppliers know, let your catering services know. As soon as we start putting demand for healthy, whole food, colourful food items, then that's when the procurement services are going to start listening. Just another quick, this is the kind of science that I put into my evidence-based arguments for veganism that I do for the NHS and do for the BBC. So I love studies like this because they're really, really big. They're over 60 years. This was 150,000 people, and it showed that on average, there was a 7-year increased life expectancy for people that followed a vegan diet. 60% reduction in type 2 diabetes, about 40% reduction in high blood pressure, lower risk of heart disease, and lower risk of BMI. Now, I'm not here to lecture you about your health. That's not why I'm here today. But in this big study of 3 million people, there was a meta-analysis. It showed that the all-cause risk of GI cancers, so all-cause risk of gastrointestinal cancers, was reduced by 30% by following a plant-based diet. Now, the reason that I'm telling you this is because, not for the health reasons, although they're so very important to me, but because if we start reducing that use of general practice, of hospitals, of surgery, then we're going to have so many more resources and so much more energy to be using on non-preventable diseases. And in a large Taiwanese study of Tibetan monks, actually, it showed that there was a 15% reduction in access to prescriptions and healthcare for those monks that followed a plant-based diet. Now, when it comes to energy, that is an absolutely massive proportion when we think about all of the energy needed for all of the heart surgeries, for all of the medications, for all of the follow-up for the long-term preventable conditions. That's massive. And obviously, this is not very scientific. This is from the Metro, but this is my good friend, Dr. Shireen Kassam, who founded Plant-Based Health Professionals. She's a consultant hematologist at King's, and she's wonderful. This is an article that I wrote for Vegan Food and Living magazine, which talks about how we're essentially just waiting for another pandemic to happen. We know that SARS, MERS, bird flu, swine flu, COVID, Ebola, Zika, possibly HIV, they're all zoonotic. They're all from our treatment of animals. And we know how many resources were used during the pandemic, how much single-use plastic that there was. So if we continue factory farming in the way that we are doing and keeping animals in such close proximity to each other, we're causing breeding grounds for pandemics, essentially. We also know that 47% of the UK's antibiotics in the last, that was about 3-4 years ago, they are reducing. 47% of the UK's antibiotics was used on livestock. And we know that antibiotic resistance is a massive, massive issue in hospitals. So what do we care about? We care about how much things cost. So in this large study by the International Comparison Programme, looking at 150 countries, they found that a whole food plant-based diet is 1/3 cheaper. So yes, you can go out and you can buy all of the expensive vegan things and the Ben & Jerry's, and it probably doesn't change the cost that much more. But actually I've found, and loads of my friends have found, that when we're just buying, the grains and the legumes and things that don't really necessarily go off, we're saving a lot when we've transitioned to a vegan diet. So it definitely is possible. I think you just have to know how and get used to those kind of shopping practices. But that's useful for hospitals to know anyway, and that's what the hospitals are asking me about. So is it possible? Is this going to happen? Well, we've got 8 universities, including the University of Birmingham, University of Kent, and University of Cambridge, that are saying yes, they want to transition towards a whole food plant-based complete diet. The 11 New York public hospitals have recognized that it's not possible to sustain that many sick, obese people with heart problems. So they have transitioned already to a vegan diet within the hospitals, which is amazing. I'm interested to see the health outcomes and the financial outcomes of that because it was only last year. 22 cities, including LA, Haywards Heath, really random, Lambeth have just signed it, and Edinburgh, of course, have said that they are transitioning all of their hospitals, nursing homes, and schools towards plant-based diet. And huge meat and dairy farms across the States and across England and across Norway are also being subsidized by the government to make the transition as well. And that's what we need. We need the governments to start subsidizing and investing in sustainable futures, not the meat and dairy industry, which is what they're doing at the moment. Where do we start? So on an individual level, there's so many places that we can start. Every switch that we can make is so very valuable. If you say, okay, well, I really care about milk and I like oat milk, that's a great place to start. Help other people as well. There's so many different brands, so many different alternatives, and you might try one and not enjoy it, and it takes a bit of time to find the ones that you do like. But it's definitely worth trying, and it's good fun as well. It does make eating more mindful. And a commonly quoted saying is, the only thing that I regret about going vegan is that I didn't do it sooner. And I never believed that. But now, I feel better. My energy levels are better. I'm eating really healthily. I eat at least 10 of my 5 a day, I think. I really enjoy it. So, it's easy as well when you join Facebook groups and you see what other people are doing. Join Instagram groups, Facebook groups, social media groups, because that's really good motivation to help you stay on track and gives you food inspiration as well. So in terms of what we do in the hospital, in terms of what we can do in the hospital, I spent a year of really harassing the CEO of the hospital, the procurement and catering services, and I was completely ignored for a year. But I was working 13-hour shifts as a junior doctor, and there was no food, and it used to really get to me. But then after a year, and when I explained why, and we'd been through all of these meetings, they eventually started introducing vegan foods into the hospital. So these are some of the meals which we were served in the hospital that I was working at the time. And they said that there was no more food waste than with the meat comparisons, and everybody really enjoyed them. So that was really nice, positive, and I think I just put that in there to show you that if you believe in something, then just keep advocating for it, whatever that project is. If you think that that's the right thing to do, then just keep pushing, and eventually, the momentum will gain. So some resources here, some organizations. So the Physicians Committee of Responsible Medicine, absolutely amazing. Obviously, plant-based health professionals. They've got loads of amazing fact sheets to do with certain medical conditions. So if you've got any patients or if you're interested in specific medical conditions, they've got some really good resources. There's loads of films coming out. This one, The End of Medicine, is by Joaquin Phoenix and his lovely wife, Rooney Mara. And I think everything that they touch is gold. And that's about animal agriculture, antibiotic resistance, etc., etc., soil degradation, and some really good websites coming up, because we're going to have Veganuary soon. So if anybody wants to try that, then it's a really good month to do it, because there's so many yummy alternatives around. This is a page that I wrote on the Kent and Medway ICS website that they added one in. I said, you know what, your website's really good, but there's nothing about diet. So on this, then I've written a piece under sustainability and diet, which just has a little bit more information about the things that I've mentioned here. So upcoming events, this is a lovely Ecomedics sharing circle for any healthcare professionals concerned about the climate crisis. It's a great opportunity for networking. We have some really, really constructive discussions about how we're feeling, any frustrations, any kind of wins and things like that. So that's great. We've got one tomorrow. So if anybody wants to come, then do give me a wave. We've got another one coming up in January and February. Ecomedics conference, which again was at the Royal Geographic Society, was so well received. Amazing speakers. We should have one coming up next summer. I've got an event, which is my charity, that is called Conversations in Conservation, and that will have 8 amazing people working on sustainability projects and conservation projects. That's on that's the first weekend of February. So if anybody's interested in that, then you can just find me, or Buckets of Love. That's a free conference online, and all of our proceeds go towards a sustainability charity. And then we've also got an Ecomedics retreat at the end of May, which should be really good fun. So come along if anybody's interested. So I love this saying. So the one who plants trees, knowing that he or she will never sit in their shade, has at least started to understand the meaning of life. So I think that's really nice, because, we might not see the effects of the projects that we're doing today or tomorrow. Maybe it takes some time for us to see the effects of them. But But it doesn't matter. We know we're doing the right thing. We know we're working towards the right thing. We've got all of the evidence there. Whatever your projects are, don't get frustrated because you don't see immediate effects. Keep the ball rolling with them, because at some point it's going to pay off. So thank you so much. Thank you for listening, and thank you for coming.